Dr. Tural, in the last video, I wanted to ask you about a baby vomiting a lot. And again, I want you to put the definition on what is a lot, why, what can it come from, what should a mom do. And I think you mentioned something that could actually be quite dangerous for, I think you mentioned dehydration. Shed some light on it.
In the newborn period, of course, most babies do spit up a mouthful or more or less. That would be a normal part of their nutrition and gastrointestinal function, because they do have a between the esophagus and the stomach, there's a free connection. So the way the baby lies, and then we do tell them, of course, burp the baby good between during the feeding to get the stomach gas out. So because if it is left there, then it creates this tension of the stomach, and then they spit up more, and then they would that gas goes through the intestine and creates a little cramp in the stomach, and baby would be uncomfortable. But beyond that, sometimes a vomiting occurs. That vomiting would, by this definition, it would be a forceful vomit, throwing up. It's not like spit up that comes, a little bit of the stomach content comes up. So that happens, and then when it happens around 1 month old newborn person, first newborn male baby, and sometimes we do see female babies having the same pattern, that indicates to a problem with the stomach outlet, where the stomach content goes into the intestine. There's a muscle there that would turn hypertrophic and blocks the lumen, the passage from the stomach to the intestine. So that does not resolve by itself. That's a surgical intervention that takes for it to be repaired. So when the vomiting happens on a persistent basis and progressively gets worse between 4 to 6 weeks of age, that would be a sign that they have to contact the doctor right away and seek a resolution of the symptom.
I see. And is that the only reason a person, a young child, a young baby would be vomiting? Could it also be that the food isn't quite agreeing and it's just not something the baby agrees with?
That's true. At the beginning, the very first few days of life, sometimes you get unlucky and then you put them on one kind of formula, and then that doesn't agree with the baby. And then, of course, the most important sign of that would be vomiting, and of course bellyache. And a child would not be comfortable, would not stop crying, and then that would be the most common reason for vomiting, probably in the newborn period, is the formula intolerance. Be it from a allergy to protein, be it from lactose intolerance, or what have you. But they do have that pattern of stomach pain and vomiting and poor PO intake. So they would not drink normal expected amounts. They would persistently vomit, and then they would be not really interested in food.
Okay. And a big problem there is dehydration. And how long, should a mom wait that she goes, whoops, this is too long. I gotta go and call the doc or go there.
Right. 1 day is sometimes enough time for them to give the child. Sometimes they don't wait one day. They would see that the problem is persisting 2 feedings in a row, and they would contact the doctor. And then in between those 2 feedings, and then between the time they contact the doctor, sometimes, as I said earlier, that they would seek advice from their support person. And then if that doesn't seem to resolve the problem, then they do contact the doctor. And we oftentimes try to test the feeding issue to be a truly a transient problem, or if it is a persistent problem. So we do give them advice of feeding the infant with warm water feeding to allow the gastrointestinal system to function, to move, work without overburdening it. Water has no nutrients in it. It's just water. It clears the stomach. If it is a mucus or something that was sitting in the stomach, it would clear that, and it would create a peristaltism, the movement of the bowel towards the rectum, that clears the trapped gas or intestinal blockage or something that would relieve the symptom of bellyache, and then therefore the vomiting. So we test that by advising them to do that kind of feeding one time or so, and then we see if the result is that the problem is now resolved. Then we just advise them to go back to their original formula. But if the problem is persistent,
if it happens again, maybe do the same and change the formula.
Then we do that.
Okay, but the point is that moms should be careful if a baby is vomiting, that she doesn't dehydrate the baby, and if in question, seeks out the help of a doctor right away, so that, because dehydration, I mean, I remember having had it once or twice actually, and without realizing it, I was running around India and it was hot, and I didn't, and next thing you know is I was actually down and out for about 3 days and had no clue why. Till finally it hit me what actually happened. Dehydration, I'm sure for a child must be as devastating as for an adult, and even comes faster because it's a small body.
Yes, exactly.
Yeah, so good.
Because
Dehydration is the thing to look out for, and it can come rather fast. Half a day, go call the doctor, see what needs to be done, right?
Yes.
Good. Well, all right. Thank you very much. I'm sure that's helpful to the moms out there and the dads. Bye-bye.
Thank you.